Hi everyone, welcome to this Tutor to You revision live stream. Tonight we are revising NCFE T-Level Health Core A. This is our first ever T-Level Health live stream, so I'm really excited to be doing this with you this evening. Laura couldn't make it tonight, so you've just got me, so hopefully I'll be able to keep up with you all in the chat. So the way this works is if you are a subscriber to our channel, you can type your answers into our chat box on YouTube. So make sure you're a subscriber and then you can take part. I will go through a few tips and hints about AO1 in your exam first, and then we will do some revision games and activities, and that's when I would really like you to participate. So I'll just load up our slides. Okay, so AO1 is knowledge and understanding of concepts, contexts, theories and principles in healthcare. So this is like recall of factual information from across the specification. As you know, your Core A specification is really large, so there is lots to revise here. We won't be able to cover every single topic tonight, of course, we're only here for 30 minutes, but we'll do as much as we can, and if you join us for our subsequent live streams, I'll try and get coverage of the other topics as well that we don't quite have time for this evening. Okay, so AO1 on the screen there, as I said. So AO1 questions will test your recall of appropriately selected knowledge. That means you need to read the question, understand exactly what knowledge it's calling for, and recall it from your mind. So most of the short answer questions will assess AO1, but there are marks for AO1 throughout your paper, and your extended response, so that's your longer answer questions, also have AO1 marks as well. On paper A, you've got 116 marks in total, and 26 to 31 of those marks are allocated to AO1. So to achieve as many of these marks as possible, you need to have, as I said, a wide-ranging knowledge of the specification. You need to link your answer accurately to the context of the question. So if the question contains some additional information, that is there to help you pinpoint the right part of your knowledge. You also need to use key technical terms. and have sentences that are clear and concise. Okay. So as I'm sure you all know, your exam is split into 4 sections, A, B, C and D. I'm not going to read all of that out, but on your screen you will see the 4 sections, what those sections cover, which parts of the specification. Okay, I have put the link for this PowerPoint, the website where you can download this PowerPoint, into the chat. You can do that after the live stream finishes, because I just need to hit submit to upload the PowerPoint. Okay, so it's not there yet, but it will be at the end. Okay, so let's get straight into our first activity. So I'm going to give you 60 seconds. There will be a timer with some music, and I want you to look at those statements on the screen. There are 8 statements, and I want you to categorise them based on whether they are the purpose of a disciplinary policy, a grievance policy, or a performance review. Okay, so the 3 categories: disciplinary, grievance, performance review, and those statements go into, each statement goes into one of those 3 categories. So I'll give you 60 seconds. If you can just type disciplinary and then give me the numbers that you think go into disciplinary, then type grievance and tell me which number statements go into grievance policies, and then performance review, that'd be fabulous. So here we go with our timer and our music. So I can see there's quite a few of you watching at home. Hopefully you're going to take part. So we're thinking about the purpose of these policies: disciplinary, grievance and performance review. "15 seconds, 10 seconds left. Okay, so I'm going to reveal the answers. Please carry on typing your answers in. I want to move quite swiftly through because I've got loads to get through, okay? So disciplinary policies, these are used when there are concerns about staff performance. So if a manager is concerned about the way that someone is doing their job, they may use the disciplinary policy. Disciplinary policies set the standards and the expectations of the job, and then they kind of use those to say, look, you haven't fulfilled your job role correctly because you haven't done X, Y, and Z. The reason we have a policy is so that everyone is treated fairly. So it sets out exactly what a manager should do if they are concerned about staff performance. So it means that managers can't just punish people willy-nilly. They have to follow the set procedure. On the other hand, a grievance policy, so students sometimes get these two mixed up. Grievance policies are used by staff members to raise issues about their employment. So that could be issues with colleagues, with managers, with what they're expected to do. It could be about hours, all of those kind of things. And then performance review is a little bit different. So performance review is something that usually happens at least once a year, and it's used by managers to monitor the progress of staff and to support staff to make progress. So again, they evaluate your performance, the staff performance against standards, they give feedback to help staff improve, and also performance reviews can contribute to CPD, because if I went to a performance review, I could say to my manager, I would really like to have extra training or learning in this area, and the manager could go, yep, great idea, Liz, let's agree some goals and targets for you. So performance review it's a positive thing. It contributes to your personal and your professional development at work. Okay, let's have a look at our next activity. Nice simple one. Give me 4. This is a 30-second activity, so not a lot of time to type your answer. I want you to give me 4 key principles of ethical practice. Now, there are more than 4, so you can give me more than 4 if you like, or if you just know 1, just type 1 into the chat. I don't mind, but as I said, it's going to be 30 seconds, so not long for this one. So don't be shy at home, type in the chat your answers. Don't worry if you're not quite sure, just put a question mark at the end of anything you're not sure about. Okay, so key principles of ethical practice. Brilliant. So someone has told me beneficence, non-maleficence, autonomy, informed consent. Brilliant. If that person, they haven't given me their name, if they could tell me what any of those mean, maybe choose one to give me a definition of, that'd be great. Someone else, Shani, I think it is, beneficence and autonomy and non-maleficence. Yep, can you tell me what any of those mean? That would be fabulous. Meanwhile, I will reveal my answers. Okay, so I've got autonomy and informed consent, truthfulness and confidentiality, beneficence and non-maleficence. So autonomy and informed consent, they go together. Because autonomy is about a person's right to make decisions for themselves. So most of us have full autonomy. If there's a question over our mental capacity, which is our ability to make decisions for ourselves, we might not be considered to have full autonomy, but we should still be supported to make decisions when we can. And informed consent is about giving people lots of information about benefits and risks and so on, so they can make a truly informed choice and they can say, yes, I do consent to you giving me that treatment. Truthfulness and confidentiality go together. So truthfulness, you also might have heard of duty of candour. That's about being open and honest with everyone that you come into contact with in healthcare. And confidentiality is about keeping people's private information private. Someone has said in the chat, beneficence, doing good for patients and acting in their best interests. Yep, absolutely. So what is in the best interest for that individual person? And then non-maleficence is about doing no harm. So not doing anything that will harm a person. Okay, so they are our key principles of ethical practice. The missing one, does anyone know what's missing? It is justice, which is about fairness, it's about equality, so treating people as you are required to by law, which is justice, but also ensuring that people feel valued and worthy. Okay, let's have a look at our next activity. Well done, people at home. Give you a round of applause. Okay, so you all know that in the UK, healthcare is organised in tiers: primary healthcare, secondary and tertiary. So think about what you know about primary care and give me 4 or 1 or 2 or 3 characteristics or features of primary care. I'm going to give you 30 seconds again. So anything you know about primary care, type it in the chat for me. Okay, so someone has written first point of contact, for example, NHS 111. Excellent, yep, really good feature or characteristic of primary care. We'll see if anyone else types anything, but I will reveal my answers and talk you through them. Okay, so my first point is the same as yours at home, first point of contact. As you said, a good example is NHS 111. I think someone else has said pharmacy, yep. A&E, yes. GP practice, yeah. So anywhere that you yourself can just take yourself because you want some information, you want some advice, you've hurt yourself, you're feeling unwell. Related to that, it's access directly, so you don't need a referral. You can make the appointment yourself, you can turn up yourself, you can pick up the phone and call yourself. Within primary care, you generally get what is known as general care or generalised care. So general practitioners, for example, are doctors that are generalists, so they have a lot of knowledge about a lot of different things that could be wrong with someone. If you go to your GP and your GP can diagnose and treat you, they will do. So for example, you might have a urine infection, a GP can diagnose that, they can prescribe you medication for that. If you've got a sore throat, an ear infection, something like that. If your GP is unsure or thinks that you need more specialised treatment, then they refer you on to specialist care. And then that links to number 4, which is deals with acute issues. So acute issues are things that happen with quite a sudden onset. So waking up with an ear infection, or over a couple of days developing a chest infection, or over a week developing a urine infection. Acute issues are usually ones that can be treated and resolved quite quickly. If you have a more chronic issue or a long-term issue, that's when you may need further treatment and specialist care. Okay, brilliant, well done. Have a round of applause. Okay, so linked to that, I would like to know what should go under my umbrella. So my umbrella is characteristics of tertiary care. So tertiary is your 3rd level. You've got primary care, secondary care, and then tertiary care on the top. So I would like to know which of those statements, there's 8 of them on the screen, would go under the umbrella. And I believe there are 4 that are characteristics of tertiary care. So I'm going to give you 60 seconds, a timer and music again. If you can just type the numbers, you don't need to type out the whole sentence. So I just want to know which ones are tertiary care. Well done, we've got some answers already. Some slight disagreement, but that could be okay, I think. We can certainly discuss it. 10 seconds left. Okay, so our options were 1, planned care, 2, often long-term, 3, individuals referred for these services, 4, examples include cardiology outpatients, medical ward inpatients, 5, examples include hospices and burns units, 6, highly specialised care, 7, specialised care, and 8 can be used as respite. Okay, so Shani said 3, 6, 7 and 8. So referrals, highly specialised and can be used as respite. Name says 4, 5, 6 and 8. So cardiology outpatients, hospices and burns. 6, highly specialised care, and 8 can be used as respite. I think neither of you are quite right. Let's have a look. Okay, so for me, I've put characteristics of tertiary care, highly specialised, can be used as respite, often long-term. Examples include hospices and burns units. Another example to show what I mean by highly specialised care is transplant services are delivered at big tertiary hospitals. So for example, the John Radcliffe Hospital in Oxford or the Brompton Hospital in London, and Papworth Hospital in Cambridgeshire, they're well known for transplant services, which is tertiary care. So the ones that are not under the umbrella, they're more related to secondary care. So secondary care is specialised, you get referred there. Examples include cardiology outpatients. So if you've got cardiovascular disease of some kind and you're under the care of a consultant, you might go and see them every 6 months at an outpatients clinic. That means you don't stay overnight at the hospital, you just go there, you see the consultant. You might see other allied health professionals like a dietitian, for example, to get some information on a good diet for your cardiac issue. You might see a cardiovascular specialist nurse. And then medical wards for inpatients. Inpatients are people that spend an overnight at the hospital, which is why they're called inpatient. And then planned care. So secondary care is planned care because you've been referred there for something. Okay, so those are the differences between secondary and tertiary care. Well done there, guys. Great work. Okay, so in a bubble quiz, I'm going to give you a question It might tell you how many answers I'm looking for, or you might need to work out how many correct answers there are. There could be 1, 2, 3, or 4 correct answers. So let me show you what I mean. Okay, so in this one, I am saying identify 2. So there's 2 correct answers on the screen. Identify 2 impacts that innovations in remote care may have. So if we introduced remote care, what impact could that have? So to do this, you need to know what is remote care, and then you need to know which impacts link to remote care. So are the answers A, processing very large data sets, B, virtual consultations, C, mobile health screening, or D, rapid identification of patterns in data? So 2 of those link to remote care. Which 2? Just type in the chat A, B, C, or D, or your combination of answers. I'll just give you a moment to think about it. So remote care is when perhaps you're seeing a midwife or a doctor and you don't see them in the same room. So maybe the doctor or the midwife is in the hospital and the patient or individual is at home. Okay, so someone says B and C, everyone's saying B and C. Okay, let's have a look. Yes, absolutely right. So virtual consultations. So as I said, you could be seeing a doctor, but you're sitting in the comfort of your home. You connect on the computer to the consultant who's in the hospital. Mobile health screening is when the service comes to you. So the service leaves the hospital. Maybe they have like a little, what do you call them? A trailer. And they park it at the community centre, and inside there are some services for screening. So there might be mammograms, so breast screening, or there could be blood testing or something like that. So A and D, does anyone know at home what innovation those 2 statements relate to? So processing very large data sets, and whilst doing that, rapid identification of patterns in that data. What does that link to? Does anyone know? What technological innovation is that? It is artificial intelligence, or AI. So, for example, what happens a lot in the UK presently is that AI is used to look at lots and lots and lots and lots and lots of images of patient organs. Okay, so it could be MRI scans of bodies, the lungs, for example, looking for markers that suggest that there is lung cancer. So you can get the computer, the artificial intelligence, to look at a lot of images of patient lungs, and they can work out, by looking at lots and lots and lots of data, that it can identify patterns, for example, very early signs of tumours in lungs, which then makes diagnosis improved, speedier, more efficient, etc., more accurate, more early. Okay, next question. Identify 2 reasons why national, organisational and departmental policies must be followed in the healthcare sector. So is it A, negative media coverage, B, termination of employment, C, to ensure safety, D, to provide consistency? Which are my correct answers? I'll give you a moment to think. Got three people that are great at answering in the chat. More of you need to join in. Okay, we've got C and D being suggested as our correct answers. I think you're correct. Let's have a look. Yep. Oh, well done. Jess has joined in as well now. Yep, so ensuring safety and providing consistency. So policies are based on legislation. So legislation are laws that tell us what we must do, what we have to do to fulfil the law. The law is generally designed to keep people safe in healthcare settings. So we see what the law is, and then we think, right, how is our organisation going to fulfil the requirements of this law? And we write our policy. So we might write a health and safety policy to help us fulfil the Health and Safety Act. We might write a safeguarding policy to help us fulfil our obligations under the Care Act. We have to follow those then to ensure that people stay safe, and then also so that every patient is treated in the same way. A and B would actually be negative impacts if we didn't follow policies. So if organisations don't follow policies, then you can see that in the media. It's negative media coverage. Or ultimately, as an individual practitioner, someone could lose their job. So termination of employment is when you get the sack because you haven't followed policies, because policies are there to keep us safe. They are there to fulfill legal obligations. Okay, next one. Can you identify 2 ways that the public sector or public sector healthcare is funded? Is it A, insurance premiums, B, taxation and national insurance, C, government budget allocation, or D, fundraising? So 2 correct answers from those, please. And then if that's too easy for you, tell me the 2 correct answers and then tell me what the incorrect answers are linked to. Just give you a moment. So public sector healthcare. It's really important that you know what that terminology means, public sector. Okay, we've got someone saying B and C. Yep, I think you are correct. Yep, a few more people saying B and C. Okay, anyone want to tell me them? I agree, B and C are the way that the public sector, so that's like your NHS, your free healthcare is delivered. So what does A link to? And what does D link to? If anyone wants to type, that would be fab. Okay, Libby says charities and voluntary. Which one, Libby? A or D or both? And anyone else want to wade in as well? Anyone that's quick at typing? Okay, so A, insurance premiums. That's one of the ways that private healthcare is funded. So you can purchase insurance, you can purchase private healthcare insurance, and then you pay an annual or a monthly premium for that. And then if you need to make a claim, you can make a claim. Yep, someone said A is private, yep. And then D, fundraising is one of the ways that the third sector or the voluntary sector is funded. Yep, great, thank you, Libby. Brilliant. Okay, number 4. Identify 2 reasons that evidence-based practice is important. So we need to know what evidence-based practice is, first of all. Then we need to work out which are the reasons that this is important. Is it A, disempowers staff, B, increases costs, C, improves health outcomes, D, improves competence of the workforce? There's quite a lot of long words in there. So evidence-based practice, you need to know what that means. You need to know what disempowers means, and you need to know what competence means. Okay, someone has already typed in C and D. Yep, a few more of you saying that as well now. Okay, yeah, I agree. So evidence-based practice is using the best available evidence which we get from research to see what is the safest approach to take, what is the most efficient approach to take, which is the approach that patients and individuals tolerate the most or are most compliant with or like the most or would choose if they could, which are the things that are within our power to deliver. So do we have the funding for them? Do we have the skills for them? And then that improves health outcomes. And then competency is about your skill set and your ability to do something well. So evidence-based practice can improve our competency. So it improves our knowledge and skills because we can see how to improve our practice, what to change, what we need to learn, maybe what our gaps in our knowledge are. Absolutely brilliant. Round of applause. Okay, I think this is our last bubble quiz. Can you identify 2 features of effective multidisciplinary team working? A, ignoring feedback from colleagues, B, actively listening to colleagues, C, sharing information appropriately, D, disrespecting members of the team. So what are our 2 features of effective MDT working? MDT working is the bread and butter of health and social care. If you guys have already been out on placement, you will have seen multidisciplinary team working. You might have seen it going well, you might have seen it going less well. Okay, Jess says B and C. Yeah, I think you're right, Jess. Absolutely. So A and D would be features of multidisciplinary team working going wrong. Okay, Well done. Okay, this one is a 60-second challenge. I am going to give you a list of legislation and then a list of purposes of legislation, and you need to match them up. So it'll be easier if I show you on the screen. So A, B, C, D, E are our legislation, and then 1, 2, 3, 4, 5 are statements about the purpose of legislation, but they've been mixed up. So you need to match the left-hand side with the right-hand side. So in the chat, you could just put a letter and the number that matches with it. 60 seconds again with some music. Off you go. 15 seconds left. Okay, so name was super quick and said C2. So reporting of injuries, diseases and dangerous occurrences regulations 2013, which we know by the acronym RIDOR, is number 2, defines employers' duties to report serious workplace accidents, for example, amputations, and occupational diseases, for example, occupational asthma. Absolutely agree. Jess says A4. So A is Health and Safety at Work, etc. Act 1974. And number 4 defines employers' responsibilities to protect health, safety and welfare at work, for example, through health and safety policy, designated person and risk assessment. Absolutely. Name then says E5, Manual Handling Operations Regulations 1992 plus amends, is requires employers to assess and minimise the risk in manual handling, moving in position of, for example, patients and equipment such as hoists. Yep. Jess says D1, so Regulatory Reform Fire Safety Order, RRO, 2005, to reduce death, damage and injury caused by fire, yet by placing legal responsibilities on employers, for example, to carry out a fire risk assessment. And that leaves us with Smart Cell says B3, so Control of Substances Hazardous to Health, Regulations 2002 plus amends, which we know as COSH. And that is a requirement for employers to control the use, storage of and exposure to substances hazardous to health, for example, chemicals and blood. So there they are linked up. Couple of things to point out on there. The main thing I think that students forget is that COSH isn't just about cleaning chemicals, it is about other hazardous substances such as blood. So blood is hazardous because it can contain blood-borne pathogens. And then manual handling, really important, it's about moving and handling people as well as heavy boxes, equipment, furniture, etc. And the key thing about manual handling is that if you're doing manual handling of an individual, a patient, a service user, you should avoid the handling as much as possible. So you need to get the service user to do as much of the movement as they can to minimise the risk to injury to yourself and your colleagues. Okay, we've done 30 minutes, but I'll keep going for a little bit because I've got quite a few more activities. Okay, so give me 4. Give me 4 reasons why accuracy and attention to detail is important in record keeping. Off you go. Give me 1, 2, 3 or 4, don't mind. Okay, so someone has said, name has said, supports continuity of care. That's a really excellent answer, and I don't think I have it, actually. Let's have a look at what I've got. I have to comply with legal duties, so your Data Protection Act and GDPR regulations 2018, to provide an accurate account of events, and that links to what Naeem has said about supports continuity of care. So if you give an accurate account of events in your record keeping, then the next person that looks after that individual can see what you've done and carry on doing what is required for that person. 3, ensure accurate analysis of results and findings. So you need to record any test results accurately so that the person that then follows up, for example, a doctor, can interpret those results and those findings correctly. Also, all of these things together, they limit liability. So that means that if we keep accurate records, we can prove in a court of law, if we have to, that we have given safe and effective care and that we gave it with informed consent. If you don't keep good records and something happens to that person, you know, if they become harmed by any of their care and treatment, and you have to go to a court, or the NHS has to go to court, if there are not accurate records, then the NHS or an individual practitioner could be held accountable or liable for the damage or harm that came to that person. So record keeping is super important. Okay, linked to that one. Can you give me 4 ways to ensure confidentiality when using screens to input or retrieve information or data? So computer screens, iPads, etc., any kind of terminal that you use in a hospital or a community setting. Okay, so we use screens all the time in healthcare these days. So, most important things to think about: protect your login and password details, so you don't share your login and password with other people. Yep, so Naeem says password protection. Absolutely. Limit access so only necessary people can access. Yep. Smart cells, beware of your surroundings. Absolutely. Use secure networks. Don't leave screens unattended. Yep, I agree. So use secure internet connections. So if you work within an NHS setting, they use secure internet connections. They also use secure email servers as well. Many places use a privacy screen or filter on the screen. And log out when leaving the screen unattended, really, really important. Okay, let's move on to the next one. Okay, this is a fun one now. So word smash, I'm going to give you a picture clue and a verbal clue. I want you to smash them together and work out what the key term is. So on the screen, we have a picture of a person and they're in the middle of something. There's lots of arrows pointing at them. And then the verbal clue is the provision of what is necessary for the health, welfare, maintenance and protection of someone or something. So we're looking for a word that links to the picture and a word that links to the sentence. Does anyone want to have a guess? You either get these or you don't get them. Okay, someone straight away said person-centred care. Brilliant. Your brain obviously works in the same way as mine does. Well done. Okay, so linked to person-centred care. Can you give me 4 or more NHS values? Off you go. Okay, NHS values, really important if you guys want to go on to an employed position in the NHS. You will need to mention the NHS values in your application and in your interview. Okay, you guys obviously know them. Ruby, I'm going to go with Ruby because I haven't seen anything from you before. Compassion, improving lives, commitment to quality of care, working together. And then we've also got everyone counts. Yep, brilliant. I think you've covered probably, oh, respect and dignity. Yep, let's have a look. Okay, so compassion, improving lives, respect and dignity, everyone counts, working together for patients and commitment to quality of care. Fabulous. Okay, another word smash. What's the picture showing us, that emoji? That was a new emoji during COVID times. And then the sentence creates a new law or changes an existing law. So smash those together. What do we have? Give you a moment. Hoping someone quick is going to get it. I will reveal in the interest of time. This is the Care Act. Okay, I've got some quick fire true or false. The Care Act sets out the duties of local authorities, including the provision of safeguarding adults boards. Is this true or is this false? Well done, Libby. Libby got Care Act. Brilliant. True or false? Everyone's saying Care Act. Yeah, brilliant, guys. Yeah. So this is true. So the Care Act does tell local authorities they must provide a safeguarding adults board. They must have one of those. Yep, name says true, I think. Yeah, absolutely right. Okay. The Care Act establishes the mechanisms for safe recruitment of staff. Is that true or is that false? Is it the Care Act that does that or is it a different act? What do we think? This one is false. So the piece of legislation that establishes mechanisms for safe recruitment of staff is the Safeguarding Vulnerable Groups Act 2006. So this is what set up the disclosure and barring service. I'm sure all of you guys have had a DBS check and you've got a DBS certificate. Everyone that works in health and social care should have that. Yeah, well done, guys. Okay, next one. Does the Care Act establish the responsibility of local authorities to implement a multi-agency local adult safeguarding system? So do you have to work together? Do agencies like the police, education, healthcare, social care, do they all need to work together to safeguard adults in a locality? True or false? Yeah, that one is true. Well done. Okay, next one. Did the Care Act establish integrated care systems, integrated care boards and integrated care partnerships? True or false? Or is this a different law? So we used to have clinical commissioning groups. Now we have ICSs, ICBs and ICPs, which are regional bodies. We do have them, but it wasn't the Care Act that established those. That was the Health and Care Act 2022. Okay, next one. Does the Care Act set out when someone can be detained and treated for a mental health disorder, or is that a different piece of legislation? So is the Care Act about whether someone can be detained for a mental health disorder, or is that a different piece of legislation? What do we think? That one is false, and hopefully you guys know that it's the Mental Health Act 2007 that sets out when we can detain someone, So certain people have powers to detain individuals under the Mental Health Act, the police can, and so can certain health professionals. Okay, another word smash. We're nearly at the end now, guys. So this time we've got a picture and then a statement. And the statement says a body of persons specially designated or selected to act in an advisory, administrative or legislative capacity. That's quite a mouthful, isn't it? So the picture in the red circle-ish sort of shape. They have a clipboard, they're wearing scrubs, there's gloves, there's a heart, there's a red cross, there's a blood pressure monitor, there's a stethoscope. Who could they be? And then in the second picture, there is a lady in a uniform. There's a lady that looks like she's pregnant and the lady's touching her belly. So I said advocate. No, I'm looking for 2 specific professions, something, and then what that statement links to. Brilliant. Ruby says Nursing and Midwifery Council. Well done, Ruby. Brilliant. Okay. So give me 4 roles of regulators, such as the Nursing and Midwifery Council or NMC. So can you give me 4 roles of regulators, not just the NMC, but other regulators like the General Medical Council, the General Dental Council, Health and Care Professions Council, Nursing and Midwifery Council, Social Work England. What do they do? What is their role? Just type me 1, 2, 3, 4, 5 if you know. Okay, we've got check people meet standards. Nice. Definitely on my list. Do we know any other roles of regulators? Okay, let's reveal. Provide code of conduct to follow. Yes, Ruby, excellent. Okay, so they have quite a lot of roles, but I've tried to summarise them here. Principal role is to protect the public. That's the function of regulation, whether it's of a service or professionals, it's to protect the public. They do this by setting standards for education, training and practice and the code of conduct, as Ruby says. They hold a register of qualified professionals who meet those standards, and then they can take action against those professionals on the register if they don't meet standards. So they can put them under supervisory practice, or at the extreme end they can strike them off and prevent them from practicing again. Smart Cell says inspections. Yes, regulators of services like the CQC do inspections, but regulators of professionals do not do inspections, but they can do like a fitness to practice panel, which is kind of like going to court to hear evidence about your practice or your failure to practice effectively. Okay, last but one activity. Final word smash. What is the picture? And then the sentence says to protect someone or something. This is a super important key thing in health and social care. What does this represent? So we've got a metal box with a combination lock on it. We've got a green tick. So someone said safeguard. Yeah, I'm going to give you that. Well done. It is safeguarding. Yeah, well done, Ruby. Yeah, brilliant. And this is your last activity. So can you give me 4, or if you know them, all 6 of the 6 principles of safeguarding, which are laid out in the Care Act 2014? Yeah, brilliant. Everyone's saying safeguarding. Well done, guys. So do you know those 6 principles of safeguarding? Write in the chat as many of them as you can think of. Okay, so we've got empowerment, protection, prevention, proportionality, partnership, accountability, and yeah, everyone's saying the same thing. Let's have a look. So there's the P's: protection, prevention, proportionality and partnership, and then the others, empowerment and accountability. If you find it helps you, you can use Pepper P to help you remember these. Yeah, so Pepper P can help you remember these. Well done, guys. Well done, Ruby. Well done, Jess. Can't remember who else we've had. Loads of people. Well done. You've done a brilliant job. So if you join me same time next week, we will look at doing more topic revision, but we're also going to look at skills for AO2. So that is more about explaining your points. So we'll look at maybe some example student responses and decide which is a stronger response and why. But in the meantime, happy revising, guys. Have a great week and I will see you all soon. Bye.